11 bills to help address this issue. First, in the area of preventing more people from becoming addicted, House Bill 314, sponsored by Representative Kunze and Baker here to my left, prevents opioids from being prescribed to minors without their parents' consent. House Bill 332, sponsored by Representatives Antonio and Washington, Representative Antonio, creates higher standards of care requirements for physicians treating chronic non-cancer pain. House Bill 359, which I'm sponsoring, requires a consumer fact sheet to be given to patients receiving an opioid prescription. Representative Driehaus and I, here to my right, are sponsoring House Bill 367, which requires prescription pain pill addiction and the linkage to heroin be taught as part of the health class curriculum in our schools. And Representative Sears will be introducing a bill that will mandate that opioid prescriptions for acute pain be filled in smaller increments instead of all at once. The second piece of this is we need to tighten the chain of custody to prevent addicts and criminals from diverting more pills out of the medical system. House Bill 341, introduced by Representative Smith here to my right, requires all prescribers to check the OR system before giving a prescription for an opioid. Both Representative Smith and I are sponsoring House Bill 378, which requires drug recovery treatment to accompany the prescriptions for medication-assisted treatment drugs, which in some cases are addictive. Representative Sears will be introducing a bill that requires persons picking up an opioid prescription to show their driver's license or photo ID. And House Bill 366, which I'm introducing, requires hospice organizations to appoint one point person to keep track of the medications used and do pill counts, lock up unused medication, and dispose of medication after it's no longer needed. And finally, we have to keep those struggling with addiction alive. And Representative Driehaus and I are sponsoring House Bill 363, which creates the 911 Good Samaritan law that would exempt someone from prosecution for minor possession if they attempt to save the life of someone who is overdosing. And we have to get people into treatment so they can recover. And I'm introducing House Bill 369 that would require each and every county to have a full spectrum of integrated opioid addiction recovery treatment and recovery housing. The bill also requires insurance and Medicaid to pay for opioid recovery treatment and provides funding for the specialty drug courts. This epidemic is growing under the current structure of our medical system and addiction treatment system. These bipartisan bills represent transformational change in both systems and are sure to stir controversy. But I believe that with the help of the medical community, the treatment community, and the criminal justice system, we can break the back of this epidemic together.